full screen करना, so just like it.
हाँ फुल स्क्रीन देखो,
YouTube पे देखो कैसे है।
मजा आ रहा है पता नहीं, हमारा मेरे को वैसा आ गया ना समझ लो। ये अब कराया तुमने, YouTube थोड़ा लेट चल रहा ना, ये आ गया अच्छी।
ठीक है, चलो
करो सेकंड सेशन
सेशन 2 हो रही है।
Okay, good afternoon, everyone. I am Dr. Shikha. So I welcome you all to the fourth session of Pharmacovigilance program. So in previous session, you gone through the sources of pharmacovigilance. Now I will discuss the adverse drug reactions. So adverse drug reactions are basically the noxious and unintended effects that occurs on the normal doses used in man for the prophylaxis, diagnosis and therapy of the disease or for the modification of physiological functions. Means if you're using any kind of medication and it gives you any kind of rashes, any kind of discomfort to your body, so at normal doses which are used for the normal doses, so that is called the ADR. So this is the definition given by WHO, World Health Organization. So the World Health Organization defines ADR, that is adverse drug reaction, as a response to a drug with three strict criteria. Means it will be considered as ADR if it occurs, if it follows these three criteria, that is noxious and unintended, occurs at doses normally used in man. Next is prophylaxis, diagnosis or therapy of the disease. Prophylaxis means that you are giving a medication for the treatment of something, it is not diagnosed. So it's just for prophylaxis. Matlab you are suspecting the disease in the patient, but it is not confirmed. So you can give the medication. So that is called prophylaxis. And diagnosis means if any disease is diagnosed. So for that treatment, you are giving the medication. Next is therapy of the disease or for the modification of physiological functions. So moving on the next slide. It is the clinical reporting taxonomy. Means clinical reporting means ki how the ADRs are reported in the system. So that is classification by type. By the type of classification. So first the ABCDEF system, it is categorized, often used in the clinical regulatory reporting. Next is, that is, you can see this diagram. A stands for augmented. B stands for bizarre. These are the types of ADR. So type A stands for augmented. Type B stands for bizarre. Type C stands for chronic. Type D stands for delayed. Type E stands for end of the use. And type F stands for failure. So one by one, we will discuss all these types of ADRs. So first one is the primary divergence, that is augmented and bizarre. So now you will see the difference between type A and type B ADRs. So type A stands for augmented and type B stands for bizarre. So type A are the common, predictable and dose related ADRs. Means it is common, it is predictable, that you know if you are taking a certain medication, that then you can get these ADRs. So it is predictable, you can predict it, and it is dose related. If the dose exceeds, means the chances of getting the ADR, it also increases, and it is vice versa. Next is an exaggeration of normal pharmacological effect. Next is, means it will enhance the normal pharmacovigilance, pharmacological effect. Means if you are using warfarin, that is a blood thinner, or you can say anticoagulant. So if you will use warfarin in the high dose, it means it will increase the chances of bleeding. Means it will thin your blood too much that there will be the chances of bleeding, the chances of bleeding will be increased. Or it can be hypoglycemia with the insulin. So these are the examples of type A, that is augmented. Clinical examples are bleeding with warfarin, and second one is hypoglycemia with insulin. Means if you are using insulin, uh, dose is increased and it is not needed in your body, so you can get hypoglycemia, means the level of glucose will be reduced in your body. That could also be dangerous for your health. So moving on this side, there is type B, that is bizarre. It is uncommon, unpredictable, and not dose related. It is not related to the dose. It can occur on the small doses also and on the high doses also. Next is often idiosyncratic or immune mediated. It could be immune mediated, means immune system is responsible for having these types of ADRs. Okay, so examples are, clinical examples are anaphylaxis with penicillin. Next is Stephen Johnson syndrome. So moving on to the third type, that is the chronological factors, that is chronic versus delayed. So type C stands for chronic ADRs and type D stands for delayed ADRs. So type C occurs due to prolonged therapy and cumulative doses. So dose related, mostly predictable. It chronic means if the person is having a chronic disease and he or she is being treated for a long period of time, then there are the chances that the patient can get type C ADRs. Okay, so it can be dose related or basically mostly it is predictable. So with the long term therapies, means if you are having hypertension, diabetes, or any kind of cardiovascular disease, which treatment is chronic with the long period of time. Next is example, clinical examples are osteoporosis from long term corticosteroids and adrenal suppression. Means osteoporosis is a disease basically occurring in your joints. In this, the bones are uh, porous basically, so it will affect your joints, and that's why the treatment includes corticosteroids. It will reduce the inflammation of the joints. So a long term use of corticosteroids will affect and will give you a type C ADR. Next is type D, that is delayed. So it is become apparent long after drug use, even after treatment has stopped. Means it can occur when the treatment is stopped, and delayed means the effect will be shown after a long period of time when the drugs are being stopped. Okay, so next is clinical examples, that is teratogenic effect, birth defects, and carcinogenesis following chemotherapy. Means if the person is having chemotherapy, then also there could be a delayed effects after the treatment is stopped. The patient can experiences many of the ADRs, and teratogenetic effect means the birth defect when uh, a fetus or a baby or an infant is born with any kind of problem or disease. So that is teratogenic effect. Next is the cessation and interaction factor, that can be end of use and failure. So this is the fifth type of, type F is the fifth ADR, fifth type of ADR. Type F stands for failure. So it is unexpected failure of the therapy, often due to drug drug interaction. So as I told you, drug drug interaction could be there when a number of drugs, polytherapy is used. Polytherapy is used, so drug can interact with each other, that can cause the failure of the therapy. Means it can reduce the pharmacological effect of the drug, and the desired therapy could not be achieved. So that is type F, it is failure. So example is antibiotic resistance or efficacy of oral contraceptives. So antibiotic resistance is a very common and very common problem uh, in this era, because we are using antibiotics without any uh, knowledge. We are using for for viral infections also we are using antibiotics. That is not a rational therapy. So this side, this is type E. Type E is end of use. So it is the reactions occurring specially upon the withdrawal or cessation of the drug. Means if you are using narcotics drugs or a drug which can form a habit forming drug, basically if you are using, then there is the this ADR type E, end of use. Means end of use means if you are stopping the drug, then you are getting ADR. So that is called type E, end of use. So clinical examples are opioid withdrawal symptoms or rebound hypertension after stopping beta blockers. Next one is the clinical severity spectrum. Means now this was the now previous which we have discussed. It was according to the classification of types, type of alphabetic basically. Next we will do clinical severity spectrum. Means this classification is based on the severity. Means ADRs can be mild, moderate, severe or lethal, that is death causing. तो mild means mild does not require any antidote. ठीक है, treatment is also not required and hospitalization is not so prolonged. Means if you are giving normal treatment, then this mild mild ADR can be resolved. Next is moderate. It requires specific treatment and therapy change. Means if moderate ADR is there, you have to change the therapy. You have to go with the another therapy and you require a specific treatment. So next is may prolong the hospital stay. Means if you're having moderate ADR, so hospital stay can be increased more than 1 day. It can get more than or equal to 1 day. You have to stay in the hospital. So third one is severe. Severe is potentially life threatening. If it is untreated and it is not resolved, then it can be life threatening. So causing permanent damage or requires intensive interventions. Okay, so this is the severe. And lethal, that is the fourth point. It is directly or indirectly contributes to the death of the patient. If it is lethal, means the patient has to die, matlab he or she will die after a period of time. So this was the second classification on the basis of severity. Now the paradoxical silver lining. By definition, adverse drug reactions are noxious and harmful. Yet, these unintended effects frequently birth new medical treatments and derive systemic pharmacological innovations. Right? If you're having any kind of ADRs, which was not predictable and which was not predicted earlier, so it can get our researchers can get a new topic of discussion and the new drugs can be formed. So basically, it can help for the new systemic pharmacological innovation. So moving on the next slide. So next is how noxious reaction derive medical progress. Means ke how noxious or unintended reactions can derive medical progress. How it can lead to medical progress. So first is drug repurposing. What is drug repurposing? So it is basically the side effect can become the primary therapies. Basically, which was the side effect of the drug, it is now converted into the therapy. So example is certain diabetes medications were causing weight loss and now they are heavily utilized for the obesity management. So this is called the repurposing. Means when a drug is having a side effect, that side effect can be converted into the treatment basically. So this is the example. So already they are saying that some medications, diabetic medications, were caused causing weight loss. Now that medication is being used for the obesity management. The second one is improved safety monitoring. So reporting systems like FAERS, that is FDA Adverse Event Reporting System, aggregate critical data, allowing regulators to issue alerts, update labels, or withdraw dangerous drugs. So, this is also improving our drug monitoring. If any drug is not safe for the population, so that is also being, it is also helpful for the monitoring purpose. Next one is personalized medication. Studying ADRs identified the genetic markers, that is pharmacogenetics, allowing clinicians to predict patient risk and prescribe safer tailored therapies. So basically, uh, if a group of people are getting, if a group of people are getting any kind of disease, sorry, any kind of ADR with a medication, so that can also be studied, and that particular group of the people, that particular community of the people are at the risk, so the clinicians will predict that this medication should not be given to that community. So basically, it will be also helpful for the personalized medicine. Next is the true cost of adverse reaction. So ADR remain a leading cause of death and a massive public health challenge. That is, more than 1.25 million serious adverse events were reported in US alone in 2022, an approximate 1,75,000 death resulting from these serious events in the same year. So this is basically the consequences or the prevalence report of having ADR reactions. Next is, means they are saying ki more than 1.25 million were reported and approximate 1,75,000 died and in the same year. Next is the systemic collateral damage healthcare. So this is the systemic collateral damage, means systemic burden. So first one is healthcare bottlenecks. So ADRs accounts for approximate 5% of all the hospital admissions and occurs in 10 to 20% of hospital inpatients. So basically, they are telling that this amount, particular amount of the people are having 20 to 10 to 20% of people in the hospital are having ADR or being admitted for the same problem. So next is economic impact. That is, if it will increase the stay in the hospital or hospitalization, it needs surgery and a lots of productivity cost frequently exceeds the actual cost of the prescribed medication. Next is diagnostic confusion. Means ADRs mimic other diseases also. Means it is very difficult to diagnose. It is very difficult to distinguish between whether the person is having a disease, particular disease, or it is having a ADR with the medication. So this is the problem. That's why the physician sometimes also get confused whether the person is having ADRs or diseases. So triggering unnecessary investigations, misdiagnosis, and delayed treatment also. So last one is erosion of trust. Means experiencing harmful reduced quality of life reactions, causing to causing patient causes patient to lose confidence in providers and abandon necessary treatment. Means sometimes the patient get terrified if he or she is having ADR with the prescribed drug. Next, the duality of modern pharmacology. Next is ADR reaction present a profound clinical challenge requiring rigorous monitoring, precise taxonomy, that is A, B, C, D, E, F, and vigilant reporting to prevent patient harm. Simultaneously, understanding these unintended mechanisms provide the foundation for pharmacogenetics, drug repurposing, and the future personalized medicine. With this, your this part of the slide is completed. Mean this was
Uh,
all about the ADR. Okay, what are the types of ADR? What is basically the ADR? What are the consequences of having ADR? What are the problems which are faced by the hospitals or any organization of identifying ADR? So this is all about ADR. I hope you all are clear with what is ADR and the classification of ADR. So thank you so much for joining. Now I hand
Dr. Shikha, there was an query in the chat box. Can you please brief out the classification on the basis of ABCD of adverse drug reaction?
Yes, sir, sure. So ABCD basically, again, I'm going to tell you, it is so basically it is again I'm going to tell you ABCDEF means this is on the basis of taxonomy. Taxonomy means naming, right? Okay. So taxonomy, okay. So means type A. Okay, let me do it full screen. Okay, so type A again, it stands for augmented, which was predictable, common. Okay, type B stands for bizarre, which was unpredictable, and type C stands for chronic, that is for a long term treatment. Type D stands for delayed, type E stands for end of use, and type F stands for failure. So, again, I'm going to brief it. So again, it was type A was augmented, type B was bizarre. So augmented, there is a difference between augmented and bizarre. So augmented is basically common ADRs. It is predictable and it is dose related. Means if the dose of the drug is increased, and it will increase the chances of having ADR. So next is an exaggerated ADR. So exaggerated ADR means so basically it will increase. Suppose the example is given here, the patient is being uses the patient is using warfarin. Warfarin is the anticoagulant, means you can say it will not allow the coagulation, that is platelet aggregation, right? So if the dose of warfarin is increased, means the bleeding of the drug bleeding chances of bleeding can be increased. So that's why it is known, it is common, and it is predictable कि if you are increasing the dose of warfarin, so it will increase the bleeding consequences. Okay, same with the insulin. If you are using insulin at the higher doses, normally it is prescribed, if it is increased at the higher doses, so it can cause you a hypoglycemia, that is lower level of glucose in the body. So that can be also very dangerous for you. So coming this side, it is type B, that is bizarre. So it is very uncommon, unpredictable, and it is not dose related. It is often idiosyncratic or immune related. So example is anaphylaxis with penicillin, Steven Johnson syndrome. Oh, 1 minute. Just- So type B is common, unpredictable. So it is very uncommon, means it is not uh, commonly known. That you can get a problem with this. Okay, so we were at type B, that is bizarre. So it is uncommon and unpredictable and not dose related. So examples are anaphylaxis in penicillin. So if you are so anaphylaxis means okay, when you are taking any kind of medication, like especially with penicillin, means it can cause you uh, severe allergy, and that is very very painful and it is very itchy. So that is the side effect of having ADR of having penicillin. So next is Johnson syndrome. It is very rare and life threatening disease, or syndrome basically caused by the medication basically. Okay, in this you are getting a very painful blisters on your body. So that is very painful and it occurs with the treatment, and it is very uncommon. It is uncommon and it is unpredictable, means it is not confirmed कि if you are using some any medication, so you will get this syndrome. But That's again the name. It is uncommon and unpredictable. So moving on the next, it is again chronic versus delayed. As I told earlier also, okay, type C plus type D. Type C stands for chronic and type D stands for delayed. So profile, it occurs due to prolonged therapy and cumulative doses. Means it occurs dose related, mostly it is predictable. So again I told you osteoporosis for long term corticosteroids. So corticosteroids, if you are using steroids for any kind of treatment, so it will relax your inflammation. And using corticosteroids can have a very harmful effect on your body if you are using it for a chronic level, if you are using it for a very long time. So next is adrenal suppression. So next one is type D, that is delayed. Profile, uh, so its profile is it becomes apparent long after drug use and even after treatment has been stopped. So delayed itself means that the effect will be showed delayed after a long period of time after treatment is stopped. After a long time period when the treatment is stopped. Okay, so basically, so this is the example. So example can be teratogenic effect, that is birth defects, okay, and carcinogenesis following chemotherapy. If the patient is going with the chemotherapy at at that time, like hair loss after the chemotherapy, that is also the delayed ADR. Next is type E and type F. Type E is end of use and type F is failure. Sorry. And type E means end of use, means reaction is occurring especially upon the withdrawal or cessation of the drug. एक minute. So next is the clinical examples. So end of the use means if you're using any kind of narcotics, right? So it is habit forming, it will form you a habit for the regular use. If you will suddenly stop, then you will get a withdrawal symptoms. Or if you're taking alcohol for a long period of time, suddenly if you're stopping that, that also you can get a ADR. That also you can get a withdrawal symptoms. Next is rebound hypertension after stopping the beta blockers. So beta blockers are used for the treatment of hypertension. If you are suddenly stopping that medication, then there are the chances you can get the disease, you can get the problem again. So here it is failure. Type F is failure. It is unexpected failure of the therapy. Means it could be due to drug interaction, as I told you earlier also. Okay, if we are using polytherapy, if we are using number of medications for the treatment, so also there is the chances of the treatment can get into failure. Means the specific drug will interact with each other and they will form another effect that could be used for the failure of the treatment. So example is antibiotic resistance, which is very common. Antibiotic resistance means it will nowadays we are using antibiotics for very commonly, very frequently we are using. So we are using antibiotics for viral also. If you are having normal cough and cold, then also you are using antibiotics. So that is not potent, that is not rational, that will cause you antibiotic resistance. Means in future if you will use the antibiotics, that will not work properly and that will not show proper pharmacological or therapeutic effect on your body. So this will cause you the type F, that is failure of the treatment. And next is efficacy of oral contraceptive. If you are using oral contraceptive, that can also get the failure of treatment. So next is, so this was all about the taxonomy classification based on the taxonomy.
तेरे पास पीवीपीआई वाली वो एडीआर सस्पेक्टेड वाली पीपीटी है इसमें?
So thank you all for this. Now I hand this over to Mr. Hardik for the further session. Thank you so much. Mm-mm.
So thank you, Dr. Shikha, for your valuable lecture. So the next topic is Introduction to Suspected ADR Reporting Form and the Mobile Application. Please, may I have the next slide? So adverse drug reaction, as you know, that it is an unwanted, noxious effect. A response to a drug which is noxious and uninvented occurs at dose normally used in man for the prophylaxis, diagnosis, or therapy of a disease or for the notification of psychological functions. Next slide, please. Next slide, please. So, why to report ADR? ADR are among the leading causes of death in many countries, accounts for 5% of all hospital administration in India, and constitutes a significant economic burden on the patient and the government. The next slide, please. The benefits of ADR. The benefits of ADR assess the safety of drug therapies, especially recently approved drugs, provides updated drug safety information to healthcare professionals and other stakeholders, measuring the economic impact of ADR prevention as manifested through reduced hospitalization, optimal and economical drug use, and minimized organizational liability. The next slide, please. Okay. Okay. The regulatory actions on the basis of ADR reports to ensure patient safety, that is under upgrading the package insert, marketing authorization recalls, batch recall based on the clustering of ADR, changes in classification. If we talk about the ADRs, if the ADRs are reported correctly in an exact way, so that the government should recall that product, those who are producing the adverse drug reactions or unwanted effects in the human bodies. So the next slide, please. So in this ADR reporting procedure, who can report, what to report, how to report, whom to report, and where to report. We will go one by one. In the next slide, who can report? Anybody can report from the society. It might be the healthcare professional, clinicians, physicians, dentists, pharmacists, nurses, uh, any layman person, etc. All known healthcare professionals include consumers and patients can also report the ADR. Next slide, please. So what to report? Next slide. Okay. What to report? And how to report next. Yes. Yes. All types of suspected adverse reactions, that is a known, unknown, serious or non-serious, frequent or rare, reactions from all type of pharmaceutical products like allopathy medicines, Ayurvedic medicines, medical devices, etc. Next slide. How and whom to report. Use the suspected adverse drug reaction reporting form or the medicine side effect reporting form, which are available on the official websites of the IPC www.ipc.gov.in. To report any ADR, there is a website link, that is the ipc.gov.in/images/reporting form 1.3. But nowadays the updated form is 1.4. Fill that ADR submitted to the nearest ADR monitoring center, that are the AMC centers, or directly to the NCCPVPI. The next slide, please. In which we can see that is a procedure of the VG base. From marketing surveys, ADR monitoring centers, helpline number, mobile app, the ADR is reported, then it is processed by the NCC through the VigiFlow software. And then there is for the quality assessment by the National Coordinator Center through the standard operating procedures. If the quality of ICSR passes, then it goes to the clinical relevance from the vigilance, and then it is comes under the SADISCO. If it does not pass, the query is raised by the National Coordinator Center and it is returned to the ADR reporter so that he or she can fill the exact reporting details. In the next slide, please. This is then helpline number from which you can report the ADR, that is 1800 180 3024. It is working from Monday to Friday in between 9 a.m. to 5:30 p.m. Next slide, please. Here is the Android application, that is the ADR PVPI app. You can may also download from the Google Play Store. Next slide, please. My screen share has been stopped. Must wait for a while so that the internet connectivity come back. Uh, Thank you, Dr. Rohit. So these are the two types of the form, that is the suspected ADR form, and then is medicine side effect form. Next slide, please. In this, you will see the various columns that are A, B, C, D. And the next slide, please. Sir, next slide, please. Yes. In this, there is the ABCD column, which shows that the A column consists of patient information details, B consists of suspected adverse drug reaction, and the C column consists of suspected medications, and the D column consists of the reported details. Next slide, please. Yes, the A column. The A column consists of the patient initials. We have to write the initials. For example, my name is Hardik Kumar. I will write the HK. That only will be the initials to be used for reporting the ADR. Second is the age at the time of the event or date of birth. Date of birth is not mandatory. If you know, you can write the date of birth, but age is mandatory on the time of the event. The person is male or female. Then there is the weight of the body. Next slide, please. Yes, in the section B, there are suspected adverse drug reactions like event reaction date. Whenever the reaction starts, for example, if I talk about the diabetes produce neurodegenerations of the or a foot pain, that how many time after it starts. If a drug is prescribed on the date 8th of February, but the reaction starts on the 10th of February. You have to write here the 10th of the February 2026 event of reaction stop. If it stops on the 12th of February while changing some medication or stopping that medicine, you have to write that date in which the event has been stopped. Second is describe the event and reaction with the treatment with details. Here we have to write about the full details of the event. The patient is suffering from the diabetes from 3 years. He is taking the glimepiride from the previous back 3 years. He started the reaction on the 2 of Feb, like that. This type of example we have to write here in the paragraph as per the World Health Organization casualty assessment scale. Next slide, please. Here are the suspected drug medication details in which you have to write the brand name or its generic name, manufacturer if you know, batch number, date of expiry if you know, dosage used, route of administration, frequency like TDS, BD, OD, therapy dates on which the therapy of a drug has been started and on which the drug has been stopped. What are the indication for which purpose drug has been given? And the casualty assessment you have to write according to the World Health Organization UMC scale, that is the probable, likely, unlikely, certain, etc. In the next column, you have to see that the action taken. What should be the action taken with that drug? That is, the drug should be withdrawn or doses increased and doses reduced, or doses might be changed, not applicable or unknown. In the 10th point, there is a reaction reappeared after the reintroduction. If the reintroduction of the drug comes, then only we have to write. In the next step, there is a concomitant medical products integration. If the change in any therapy, we have to write the change in the dose of a therapy or a change in the frequency of a therapy. Next slide, please. In the next step, you might see the 12th point, relevant task or laboratory data with dates. If there is a relevant data provided by the person, the patient, healthcare professional, or any person, or any laboratory, we have to write it here. In the 13th point, there is any relevant medication history, medical history like allergy, smoking, alcohol use, hepatic, and renal function, past surgeries, etc. Next slide, please. In the next slide, we have to write about the seriousness of the reaction. If there is a no, you have to tick on the no. If there is a yes, we have to write the seriousness. It is a death causing, life threatening, disability, hospitalization, prolonged, or other medically important. In the 15th point, that is the outcome. That should be a recovered, recovering, not recovered, fatal, recovered with sequel, or unknown. Next slide, please. In the D, you have to write the any additional information that you are having with you. or the reporter details like name, professional address, like if I am working as a assistant professor or as I am working as a senior research fellow, MD at the hospital, we have to write the professional address, pin code, email ID, your mobile number, your occupation, your signature, and date of this report. Next slide, please. Now we will further move for the additional information. The more information on the ADR reporter that are not fit in the respective column given in ADR form can be entered in the field in the additional column. Next slide, please. So, medicine side effect reporting form for consumer. Consumer can provide detailed first-hand information about their experiences with medicine and how these medicines have affected their life. It can be controlled by National Coordinator Center of the PPI launched its first ADR reporting form for concerns in August 2014. Next slide, please. This is the form. It is available in the multiple languages like Gujarati, Kannada, Bengali, Malayalam, Odia, Tamil, Hindi, English, etc. Next slide, please. In this form, there are some patient details. Second is health informations about the doctor, pharmacist. The third is detail of the person reporting the side effect, in which he has to write his name, address, telephone number, email. Next slide, please. The fourth point consists of the medication details, in which we have to write the name of the medicine, quantity of medicine taken, expiry date, date of start, date of stopped, dosage form, is it a tablet, capsule, injection, oral, liquid, any other. In the fifth point about the side effect, when did the side effect start? When did the side effect stop? The dates we have to mention here. Then next point, next slide, please. How bad the side effect has occurred. You have to take any one of the column. Did not affect daily activity, admitted to hospital, affect daily activities, death or others. Next slide, please. Now we move forward towards the mobile application. Similarly, we have studied the ADR reporting form, how to fill that, how to submit that. Now we will go for the mobile application. Next slide, please. IPC, National Coordinator Center, PVPI, develop a health app downloaded from the Play Store, which is effective from the 29th September 2017. Next slide, please. The goal is to provide two-way risk communication defined as a possibility to report adverse drug reactions to national medicine agencies or pharmacovigilance centers and to receive drug safety information from these agencies. Next slide, please. Features are sports sources of document and images attachment, sports HCPs, as well as consumer reportings, autofilling of reporter details to the same time, paperless work. Next, steps to fill ADR in the PVPI mobile app. Next slide, please. There are three steps in this. First is a reporter information, second is patient information, third is a suspected adverse drug reaction information. Next slide, please. Download the app from the Google Play Store. Next slide. Fill the reporting type and user type. It might be the healthcare professional, it might be the consumer. Next. In first, you have to write your name, phone number, email ID, address, PIN code. Either you are consumer or a healthcare professional. Next slide, please. In this, you have to write the patient initials, gender, age, weight, and height. Next slide, please. Now you have to write the suspected adverse drug reaction details. What type of reaction occurs? The date of reaction, date of recovery from the reaction, suspected medication, or any attachment you are having, you can attach the file. Next step, please. Fill the suspected medication. Is it a single dose, dosage used, manufacturer details, batch number, date of expiry, route, frequency, and therapy start date and the therapy end date. Next slide, please. Then suspected adverse reaction. Yes, on the next slide, there is a therapy start date or the therapy end date. Next slide, please. In this slide, you have to upload the document or the source of a document if you are available. Write in a paragraph. You can write that this drug has been prescribed to me. You have to upload a perfect document for the prescription or the reaction details. Next slide, please. Then other details like any remarks or can this reaction be explained by other drugs or a disease? If possible, you can explain here. If not, then leave this column. Relevant test and laboratory data with the dates. The relevant test for the adverse drug reaction. Next slide. Serious reaction. If there is any kind of topic you want to be explained again, just write your messages in the chat box. So on the last, in the next slide, this is the processing of ICSRs through mobile app. ADR received at NCC, sent to the AMC centers for the validation and authentication within 7 days. Then it is sent back to again to National Coordination Center, unique ID after 15 days and maintaining the record. Next slide, please. So these are the about the ADR reportings of reporting forms and their mobile applications. Thank you. So any query you have, Dr. Rohit, please go through the queries. If there is any query, just let me know.
Hardik sir, there is a question. They're asking you to repeat about the Vigibase again.
Okay, sure, ma'am. The VGBase is the database that the AMC centers are having the VGFlow database in which all the AMCs or ICSRs are reported. If you are having any adverse drug reaction, we will do one assignment also for regarding that. We will provide you one form, empty form. You have to send us the adverse drug reactions that you are having this particular reaction from the drug that we should report on the VGFlow database that is regulated by the AMC centers and the national coordination centers of the PVPI. They will monitor all the reactions and go for the casualty assessments of the as per World Health Organization. If the reaction is very important and remarkable to the society, then it will go to the alerts. If it is having any issues, then the again query will be raised to you to please provide us the laboratorical test as per the informations. Any other query, ma'am?
No, sir, you can continue.
Thank you, everybody. Now, I would like to call upon Mr. Bishal so that he can discuss for the panel that what type of the sessions we have conducted till yet. So, Mr. Bishal.
Yes,
Yes,
sir.
sir.
Good evening, sir.
Good evening, sir. Good evening, sir.
So I hope all of you are fine.
Yes,
Yes,
sir.
sir.
Yes.
Yes.
So basic. So class till now we have already studied about pharmacovigilance, basic introduction of pharmacovigilance, introduction, history of pharmacovigilance. How does pharmacovigilance organizations generally took place, about the ADR, adverse drug reactions, how the adverse drug reactions can be monitored of the various drugs that are basically designed and are up to the marketed. And apart from this, what क्या था sir?
Adverse drug ADR form.
Yes, the advanced drug reaction forms has been discussed, and if you have any query till the today's session, you can ask your questions to the chat box, and we can meet through this platform by next Saturday.
Thank you, sir, for the once again briefing of the program. There are total four sessions conducted by Atelier. We will conduct the next session on the next Saturday. Be attentive for the attendance. Thank you very much from the School of Pharmaceutical Sciences, City University, Ludhiana.